Okay.
Okay. All right.
My analogy for when I'm sleeping is I'm like a 7-Eleven hot dog, like just rolling around. Like I can't get.
I got you, sure.
I can't get comfortable.
And some of these are like blown head gaskets. Some of these are oil leaks that just.
I always love your watch some of
Right.
your analogy.
He watches
It's great.
that.
Well, your oil's been leaking, but you're like, no, it's fine. Just keep pouring some in here.
That's why I had to throw the hot dog analogy at you.
That was brilliant. I never heard that one. I was like,
Because really, it's even more complicated. It's actually the front part of the disc that's massively compressed. Right? So the back part, it's like a wedge. You're saying
Right.
the front part is massively compressed, with the back part has been decompressed. You understand? That's why all the nucleus is shifted towards the spinal cord. So we call it extension traction. We bend back, we compress the back part of the disc, and we decompress the front part. Right? We're decompressing the part that's always compressed and then compressing the part of this that's never compressed. Hit the top of your head, and then since that you've been dealing with some pain. Go ahead and go over some of the pains you've been feeling since that accident.
So the initial injury, I felt a shooting, burning sensation down my neck into my back. I didn't really think anything of it at the time. A couple of years fast forward, I experienced, I would say, mild back pain would come and go.
Lower neck, lower back?
Lower neck, lower back, mainly right, middle right. And then from there, just it would ache. It would
Kinda
sore,
achy
sick and
pain?
sore. Deal with it. I was younger. This was 20 years ago,
Okay.
progressing. And about 2018, had another injury that set me back to where similar, but I woke up the
Okay.
next day and pretty much couldn't get out of bed.
Gotcha.
Missed
Okay.
work that day.
Okay.
And then probably I went to therapy for that about a year and a half ago. I was going down to bend and grab something.
Yes.
And took me down. Went down to the ground, laid there, locked up, and then the rest of that day was on and off spasming.
Okay.
And ever since then, the pain's just been 24/7. Sometimes it would get a little bit better, but it would always be there.
So the 2018 injury, your lower back, when you say you can't get out of bed, was it lower back pain and leg pain, or just one or the
Just
other?
lower back.
Just lower back
Lower
was
back.
just not letting you get up,
Right.
preventing you from
Correct.
being able to move. All right, and then the pain that you described in your shoulder, how would you say that was like a kind of stabby pain, dull, achy,
The initial-
burning, anything? Or,
It's aching.
Okay.
Right. Yeah. The initial was like a sharp burning.
Okay.
That kind of started at the neck and went down.
Okay.
But every day it just turned left or right.
you feel it in that shoulder blade area?
Yep. Right down through here.
Okay.
Yep.
All right. And I know you said you've been to a chiropractor maybe like 5 years ago. Did they take any pictures of you at all?
They did some X-rays and there was some disc deterioration,
Okay.
if you will.
But they didn't do an MRI?
No MRI. Never
Okay.
had an MRI at a chiropractor. I had MRIs done a couple years back, and I can't remember exactly. I had a little disc protrusion.
So they took a cervical MRI of your neck,
Yeah.
not lower back, just the neck? Or
No, it was the neck, or the back too, yes.
Lower back and
Yes.
what do they say? Just disc injuries at lower back
Yeah,
and lower neck?
they saw something, but it was very mild. Nobody wanted to
Mm-hmm.
do anything as far as
Okay.
moving forward from there.
Okay. When we take an MRI, most of the time they're taken laying down. So it's like a car with a flat tire. If you lift the car in the air, the tire doesn't look so flat. So
Okay.
it's unfortunate that they take pictures laying down. Most MRI machines are made for laying down because they're looking for pathology, heart, lung, tumors. You understand? They're looking for an actual, it doesn't matter if you're upright or laying down.
Right.
So they use those same machines to visualize the spine, which is unfortunate because the spine is a mechanical structure. It changes based on gravity. We have pieces of cartilage in here which are made of water, and so when you compress the water it bulges out more than when if it's laying down. Heck, if we take a picture of somebody inverted, we never see another disc injury ever again. We
Right.
magically cured disc injuries. We figured out to take people upside down and MRI them, right? Okay, so it's unfortunate they took a laying down picture. We have to see a seated picture to help the patient. It's not minor. It's actually probably moderate, you understand, or more, if we actually had weight on it.
Okay.
The injury, what happens is that the background of what happens to these non-sensitive discs is that when you have a compressive force, almost as specifically what you're describing, hit to the top of the head, where you compress the spine, the disc actually isn't injured. The disc is made of water. It's a soft, like think of your ear.
Right.
It's not going to get injured by compression. What actually gets injured is the bone, and where the bone contacts the disc, called the end plate, is what's damaged when we have a compressive force. That end plate starts to release inflammation, acid, which over a period of 10, 15 years starts to what you described on x-ray, which you really shouldn't even be able to diagnose on x-ray, which is disc deterioration. Well, it's not really deterioration, it's cooking. You essentially are taking like a piece of bacon from soft and flexible to hard and crispy by heating it up. And so that acid and inflammation starts to harden the disc and it starts to thin the disc.
Right.
The job of that disc obviously is to prevent, well, a couple things. One, the hole that the nerve passes through from the side is supported by that disc. And so as the disc becomes smaller, the hole becomes more narrow. We refer that to as stenosis, so that there's a narrowing of the nerve root. That would usually give you pain shooting down the arm. So that would be pain that would be like numbness in the hands or pain shooting down the arm. I turn my neck, all of a sudden something shoots down my arm.
Over the last year, I've had pain going down the left, and it felt almost like my arm fell asleep.
That's nerve root. We're supposed to have a curve in our spine, and maybe some of my videos, maybe I went over, you're supposed to have an arch called a lordosis, and maybe you've heard of lumbar support. What the heck are we supporting? Well, that arch allows the weight to be evenly distributed over all the segments. And when we sit or have injuries, our body tends to round forward, which takes the curve out of the spine and puts more weight on the disc, further aging and compressing the disc. The back part of the spine has a lot of feeling. That's what that local pain is, that when you're going, Ed, it hurts here, into my shoulder. That's called joint pain, or the knuckles in the spine are inflamed, going to be achy pain, local. The lower neck, for instance, refers pain to the shoulder blade. This whole area is the joint. So you have certain knuckles in your spine that are overstressed. They're overstressed mainly because other parts of your spine must be underworking. It might make sense to allow another area to be overstressed. So I have an indirect approach to the spine. I don't directly treat the areas that are injured because they're injured because they've been doing too much. They can't be assisted by, and that's unfortunate because a lot of my colleagues want to do something to the injured areas. Most medical doctors want to do something, cortisone shots, drugs to treat the injured area, where we don't zoom out and go, look, he doesn't have a curve in his neck. And because he doesn't have a curve in his neck, all the weight like a ladder is continually going to your lower neck. And any activity you do, weightlifting or working, we have to get the alignment back to being curved. In order to make the alignment change, we have to make the spine supple. If over time, when we have injuries, our spine gets guarded and stiffer, and so it becomes harder as we age to change things. 26 is full skeletal maturity, for instance, and so your spine gets harder every year after 26. Not to say it's not impossible, but we have to spend more time making you supple, and then aiming to get your spine back to what we call the lordosis, the cervical curve, which allows the weight to be evenly distributed. If you have those MRIs, I'd love to look at them one day, not today, but bring them in. If you have the ability to bring them in, I would love to show you that something like 80% of your back isn't injured. And probably nobody's told you that because everybody focuses on the injured areas and they don't let people know that, hey, look how healthy all these other ones are.
Right.
And they're so zoomed in on the ones that are injured that they're not seeing all the ones above that are not injured. And I hope that gives you some silver lining, is that, hey, if we can move the stress off that lower back and lower neck, then we have a lot of spine left to get you to 90.
I'm at the point to where if I stand too long or sit too long, both, like, I gotta get up.
Yeah.
I gotta sit down. I mean, just I'm rotating between the two. Tried several chairs and I'm sitting different.
Right.
I'm trying pretty much everything I can, but I'm at the point where I have kids. You know, they're younger.
Yeah,
I mean,
you want to play with them.
trying to have activities with them, and you can't do it. It's frustrating. I haven't been working out like I want to, so I feel like I'm losing a lot of life and stuff like that. So I want to get back to that, and it's really frustrating at this point.
You don't have the conscious ability to choose where your spine bends. It's not something that needs to be taught to you, like stop bending here and start bending here. It's not how it works. Your spine bends on a volunteer basis. So by working on the younger parts of your spine, getting them loose, that have been stiff for a while, which they're not going to like per se, we're going to take the stress off the ones that are overworked. It's okay.
Sorry.
When you do that, tell me what you feel.
Feel tension right here.
Okay. Just in the shoulder, just in the trap there.
Yep.
Go ahead and turn your head right.
Yep. Same thing.
Just trap pain.
Yep. Feel a little bit pull here and a little bit right here, but usually it's like down in the trap.
Okay. Definitely limited range of motion here a little bit. Let me look at you. All right. So we have Yeah, you're in what I call left avoidance. Your head is tilted to, you're actually leaning, your head's translated to the right, left shoulder's a little elevated. You're in kind of your body's trying to get away from that left side. So we'll have the initial injury area, which your body leans away from. Then you have the compensatory injury of now the other side is doing extra and now hurts as a result.
Right.
So we really have almost two injuries. That's why both are involved here. And your body will do this very intelligently, like hot potato. If I give you something hot to hold, you're gonna
Right.
move it around. That's what you're describing when you're saying, Ed, I'm sitting, I can't get comfortable. I gotta move the hot potato over here, then I gotta put it over here. How about we just not have a hot potato? How about we just
Yeah,
not have something
agree.
that's irritating that you feel the need to move around constantly? And that's what that injured disc represents. The injured disc is the hot potato that needs to be calmed down. And we can show you some things to calm it down. And then essentially like a tooth that you have cracked, we have to stop chewing on it.
My analogy for when I'm sleeping is I'm like a 7-Eleven hot dog, like just rolling around. Like I can't get.
I got you, sure.
I can't get comfortable. I'm laying there just in pain. I'll put
Correct.
because I have some sciatica
Yes,
going
sir.
down. I'll put a baseball there, trying
Absolutely.
to just relieve
I'm
it.
helping. I'm helping. We're
yeah,
going
so
to balance your spine. We got a lot of young parts
Yeah,
of your spine
okay.
I'll show you, but about an inch and a half forward, your head. So the ear hole should be over the center of your shoulder. The muscles in the back part of your upper traps and back here are working harder because of the alignment of your head to shoulders. So if your head's forward, the muscles work harder than they're supposed to be. In order to actually change it, we have to actually, we call mirror image adjust and stretch you. We have to hold you back here so that your body will actually want to be in the middle where we're supposed to be. A lot of this has to do, again, what I said earlier, the front part of the spine has very little feeling. So when we have these types of injuries, our body rounds forward. What you see elderly people doing, they're all going farther and farther forward. So we want to combat that, keep your body upright. Cross the arms for me. All right. So what we're going to do is bend the knees. We're going to try to loosen and adjust the parts of your spine that are not injured. Now, they're not going to exactly love the idea of being told to work again. They've been probably not working, but because they've not been working, they're looking younger on MRI. And that's what the medical world would actually call unremarkable. You'll see vertebrae that aren't injured, you understand?
Right.
They haven't aged at all. They say unremarkable. And I go, no, it's remarkable that you're 45 and your lower back or middle back still looks 18, right? That isn't unremarkable. Deep breath in for me. We'll sit up. And then exhale. Deep breath in for me. Try to keep exhaling. Let it go. There you go. Let it go. Relax. It's okay. Deep breath in. Let it go. Exhale. Let the jaw relax. There you go. Very nice. All right, yeah. Dry bones. Those have not worked in a while. The goal of this adjustment is to not adjust the lower back that's injured. We're trying to adjust the areas above and below. Okay. So you saw me there, we adjusted the middle back. I'm gonna do it again here a little bit. Deep breath in. It's okay, you're not gonna fall. Exhale. Good, a little bit more there. Good, very nice. And then one more time, breathe in, I got you. Exhale. Good, other side for me, very good. Other side, bottom leg straight, you got it. There we go. Perfect, deep breath in. Put this hand right here. There we go, good. Exhale. Breathe. Exhale. All right, now face out for me. Real stiff on that left hip. Okay. If everything moved beautifully, I'd be confused, right? You understand? If all the parts that are young in your spine were moving the way they're supposed to be, how did you end up hurting yourself? How did you end up having any stress in your lower back and lower neck? So your left hip being stiff doesn't surprise me, but that has to be, saying it's like a placement test. You understand? I'm giving you a placement test, and then some questions you're failing, some you're doing okay on. Does that make sense? I want you acing these tests, and that would be the progression of our care. You'd see, Ed, now my left hip moves now. On visit 4 or visit 5, I finally get that left hip moving. It's not good, but this is like I'm getting the baseline here of seeing how your spine moves cold. Ed, you didn't massage me. Why didn't you massage me first? I think if you massaged my glute, maybe my joint would move. I'm trying to see, again, I'm just getting in the car, sticking the key in and turning it. Yep. I'm not popping the hood yet. I'm just seeing what the stock movement is, what you've been living with, because this gives me an idea of how your spine's been aging. Okay. All right, just seeing where this wants to be. Wow, I mean, ever felt this big bump here on the right side of your neck?
Yep.
I mean, look how it's like much smaller. So essentially your head is tilted left. And that's what is going also, when your head is translated right, it's popping out the atlas on your right-hand side. You're essentially in left head tilt. And then the bone is sticking out here on the right. You like to sleep on your left side sleeper. You got to get off that right.
He's a hot dog.
Yeah, well,
Yeah.
he definitely doesn't like being on his right side because that would compress this bump over here.
Yeah.
The right-
You're right though. I try to get comfortable on the left side.
You're going to be more comfortable. I mean, I doubt you're comfortable in many places,
Yeah.
but the right definitely isn't going to be comfortable because it makes you compress and confront this, this blowout right there. Wow. I mean, nobody's ever mentioned this huge bump right here.
No, I feel it though. I know.
I mean, that's your atlas. So the wing of the top vertebrae is shifted over to the right. So the hole leaving your skull is called the foramen magnum, and then the top bone's called the atlas. Does that make sense?
Mm-hmm, yep.
And so there's two holes through the middle of them, and they need to be lined up, right? If that top bone is off kilter, do you see how the spinal cord going through gets?
Right.
I don't like that very much. So you have to have those top two vertebrae lined up. And the first chiropractor's son, B.J. Palmer, taught exclusively to work on this vertebrae. Now, I'm not just going to work on your upper neck, but my point is that I get what he was getting at, which is that if this is misaligned, we're in trouble, and that there's a higher level of emphasis and importance on getting your upper neck worked on, getting it lined up properly, and that's why you'll hear of upper cervical chiropractors, and because less than toe chiropractors, let's go. Not as important as this guy. Does that make sense? This is one of the most important vertebrae. So you'll see us spending a lot more time up here. Mm-hmm. Easy. Very nice. You okay?
Mm-hmm.
Yeah, we're pretty stiff up there.
Yeah.
I already know that your lower neck knows how to move, and your lower neck is very eager to do the motion when I adjust you, but I'm not wanting the lower neck to do it. Does that make sense? I want your upper neck to wake up. Here we go, easy. There we go. Chin up for me.
The first one I felt like a little
Yes, sir.
sensation down my
Yeah,
arm.
no, I could tell. So what happens is because you're in left tilt, the left side of your neck is already. So when you tilt your head left, the holes in the left get smaller. Does that make sense? So you're already, the holes are already small on the left. So when I adjust you, there's not much gap or let's say tolerance. It's like moving there's that game Doctor, right, with a little trying to grab the bones through the little holes without hitting the like, oh, come on, that we're trying to thread a needle on the left side. You got very little gap. We're moving my other analogy is moving a 3-foot wide dresser down a 3-foot 3-inch wide hallway, right? There's not much room on either side to hit a wall. We're trying to open up these spaces, make the channel a little wider so we'll have more room. But we got to get off that left side. You have a favoritism of tilting left. And this is probably where that first injury happened, right up here. This is, not the skull absorbed it, but the neck. You're saying these are the joints that actually got sprained. So. And then tomorrow morning you wake up and I came in with lower neck and shoulder pain and arm pain, and I left with upper neck pain. What the heck? Right? Because I can't Jesus heal your lower neck. I don't have the power to heal wounds. Your body can heal the wounds given that it stops hitting them, right? If you stop picking the scab and keep whacking the injury, keep resetting the wound. And that's where inflammation gets a negative connotation, right? We get a bad rap because we become chronically inflamed because we chronically keep, does that make sense, damaging the same vertebrae. If you overstress your skin, you get calluses. If you overstress your muscles, they grow. If you overstress a bone, it grows. It's not a disease process. It's an adaptive process due to mechanical overstressing. This area up here is falling asleep, and we have to wake it up. And it's not going to just embrace me with open arms. That makes sense. Getting your upper neck moving it's not easy, first of all, and then secondly, your neck it's going to be a period of actually, I'm going to make it move, and then it's going to almost reflexively want to stiffen up. It's like me telling my kids to clean their room, and then they don't do it, and then I have to go. You have to kind of you have to keep on them until they're, aren't you happy yet? I cleaned my room. No, I want you to clean your room without me having to ask. Then I'll be happy, right? So it's I want the Atlas doing what it's supposed to be doing without me having to tell it to. And then that's when Dr. Ed gets happy. We'll push these ribs down when we go face down in a second. I'm going to kind of give you some more space. So we're going to open up the channel called the thoracic outlet. Bring these ribs down. Our body doesn't, the most difficult thing to understand with the body is we don't heal with the same stuff we were born with. So when we have an injury, I think of it like you're born with gold and we heal with copper. We're born with this expensive stuff that was really strong and actually took quite a bit of stress and damage to actually injure it to begin with. And then our body heals with packing material, this cheap stuff that makes it so not much stress re-injures the area. And then this happens repetitively, and then, with more and more scar tissue.
And what's the difference? Because I have the sciatica going down, and it doesn't get into my leg, and everybody's like, does it go into your leg? Does it go, what's the difference in getting into the glute
Sure.
and then traveling that much farther?
Sure.
What's the...
Just severity of the injury. Just as the injury progresses to a larger disc injury, it will go down to your foot. It's like a movie. As the movie progresses, it'll like Lord of the Rings, they're going to travel down to the mountain. It just takes time to get down there, and then as you fix it, it'll rewind back into the lower back.
Okay.
So it just tells me that it's like grade 1 versus grade 4. It's the same. Depends on how hard you're hitting the nerve.
Well, that makes sense because it started up in the top part,
yep.
and then now it's
Correct.
the bottom of it.
And 2 years from now, it'll be in your knee.
Yeah.
5 years from now, it'll be in your foot. It'll just keep progressing.
Hopefully not.
Well, not with me in your life,
Yeah.
correct. But I'm just saying that.
No, you're here.
If you're wondering, that's because that.
Good. When you said rewind, I was down with that.
We're gonna rewind
Let's
it. Yeah, we're gonna. That's actually how it'll go away. Ed, it's no longer my glute. It would be the first thing that goes,
Yeah.
and then I still feel it in my lower back, but the glute's feeling great. Now my lower back's feeling great, and then the last thing we're gonna deal with is actually the middle back. That's actually the last thing we're gonna fight because that's where the original injuries were, that have been frozen for 30 years that you've forgotten about. That's actually the core. The lower back was really the secondary injury. Does that make sense? When you were younger, a middle back injury happened that, again, it might have been relatively small, but it made your middle back quit on you, combined with sitting as you were growing. Your middle back stiffened up, and then the lower back ended up doing too much, and that was what was injured. But that really was the second injury, not the first injury. And now the nerves are being hit, and now it's radiating, and so you have... people can have sciatica without any back pain. That's actually something also happens. If you don't have the joint irritated,
Right.
people can have just leg pain without any, well, my back feels fine, so my leg's killing me. It's like, that's still sciatica. It's still the neuritis, nerve pressure. Nerves don't like being touched. I've yet to have a single person come into me saying they love to whack their funny bone. Oh, it feels great to whack it. It's just, nobody ever. It never feels good to whack it. Nerves don't want to be touched. Obviously, the martial arts love this because they can disable people and hit the nerve. So they make a piece of foam called a Denerol that is a retainer that we'll show you at the end of the visit, and it's going to hold your neck in this curved position. So why don't you just give me the Denerol, and that'll put the curve back in my neck, and we can forego all this soft tissue work. Well, if your spine is stiff, you're not going to bend very well over the stretch, and if your lower neck is the only part that moves, then when we stretch, only the lower neck is bending. That makes sense?
Right,
So you're
yeah.
just going to end up hurting yourself if we don't spend time first getting your whole spine working as a team and then retaining that with the stretching. Otherwise, I just get on QVC and sell Denerols.
Right.
Hi, Dr. Ed here. Lay on your back on this Denerol and your neck won't hurt anymore. Disc injuries, well, you have to do it in that voice too. It's always in that voice. Hi, Billy Mays here. He's always yelling at you. It's like, I think they figured out the secret. It's like, when you're being yelled at, you just want to do everything you're being told. Hi, Billy Mays here. Try OxyClean, the power of OxyClean. It's like, geez, I'm being yelled at. Stop yelling at me. I didn't do anything. With the power of the OxyClean. Sorry, back to fixing my neck. Okay, just fix my neck, Ed. Stop rambling. What are you doing? All right. There we go. We're getting there. thumbs aren't hurting so much anymore. There's a lot of resistance in your neck, and I got pretty strong thumbs, but it should be effortless. This right here should be an effortless position for your spine to go to. This is called the cervical lordosis. This is home. It's where your neck belongs. And if your neck was used to being here, you wouldn't be here, right? Your problems wouldn't exist if this felt normal. Come on, relax your neck. I got you. Okay, easy. I know. All right. Chin up. Good. Okay. All right. Very good. All right.
Body in motion stays in motion. Like he always, that's when he actually starts to feel some relief, I feel like.
So motion is lotion, sure. The joints lubricate themselves through mobility. But it's something also more spinal cord and nerve related. When you stimulate mechanical receptors, you inhibit pain receptors.
Okay.
So it's when we don't move and the proprioceptors and the mechanical sensors in the joints aren't stimulated. This is why when you bumped your elbow, you rubbed it. It kind of felt better to rub something you whacked because you're actually stimulating those mechanical receptors in the skin, and that blocks pain. So it's, what do I say? It's fine, but the problem with it is that we're not getting to the source of the problem kind of idea, right? It's helping, but if we're exercising, working out, and he's only got 20% of his back working, we're going to get in trouble.
Yeah, he won't work out with me. He'll only walk.
Well,
he doesn't do any lifts or anything because he's afraid he's going to make it bad. Or worse, I should say.
And it's highly likely because he doesn't have most of his spine working.
Okay.
What we need to get to is a place where most of his spine is working, and then we can start thinking about resuming those activities. But his current mobility pattern is 20% of his back's doing 90% of the work. Visit 3 to 5, you'll start to like me. Somewhere between visit 3 and 5, second visit you're almost worse. Third visit you're kind of okay with me. By visit 4, you start to go, Ed, I see what you're doing. I see how you're changing. The part of my spine that was injured is starting to feel a little better. And then by visit 6, 7, 8, we're usually going hard into stretching, and I'm going to teach you how to maintain that so it doesn't resume your old pattern, right? So it's like I took away all the cigarettes, and then you have withdrawal symptoms, right? I'm worse than when I was smoking every day. Well, yeah, we just cold turkey took all your cigarettes away. Yeah. You're not going to love this idea of I'm going to change things, right? And then eventually, once your body gets used to not having the cigarettes, I can breathe better, and my life's getting better, not being poisoned all the time, right? There's habits that have been formed over a long period of time, and we're going to break those habits, and your body's not going to love the idea of me breaking his habits. So you have an initial boot camp, I call it. Like if you weren't going to the gym, and then all of a sudden you started the gym and how sore you're going to be, right? It's like, well, you're out of shape, right? You're not worse, you're just out of shape. And maybe you might say, I'm weaker. I lifted weights one day, and the next day I was weaker. My muscles are all torn up. Well, that's the process of you actually tear the muscle, and then it regrows larger. In the same way with joints, when they haven't been moving and we make them move, they're gonna reflexively not like that idea. It starts off very front-loaded with me, and then it ends with me checking to make sure you're doing your activities at home, and me giving you the reins and
probably the proper stretching. So I try to stretch, but
but you're only going to stretch with the parts that are injured, right?
This is orthotic stretching, so that's
right.
I've gone hot yoga with her a couple of times.
Well, yoga's going to take whatever's moving and keep it moving, right? And you end up hurting yourself. With this mobility, he's not going to bend in his upper back. His upper back's totally frozen. So
his mobility.
If he does standing bow pose, he ain't doing standing bow pose with his middle back.
And people look at him, doctors look at him all the time, they're like, you look good. And they don't recognize that, when I say chronic, it's like daily. 20 years I can't think of in the last 15 a day he hasn't gone and told me he's not in pain.
Yeah, I don't know. I grew up with a chiropractor as a father, so I've been pretty spoiled, okay? I've had a car, it's like how I have patients that are car mechanic as their dad, and they don't have to worry about servicing their car, right? So I grew up with a car mechanic as a spinal car mechanic as a dad, so kind of had to not have to worry about new tires and oil changes, and I just take it in whenever I want it,
right.
And some of these are like blown head gaskets, some of this is oil leaks that just...
I always love watch some of your analogy. It's great.
Well, your oil's been leaking, but you're like, no, it's fine, just keep pouring some in here.
That's why I had to throw the hot dog analogy.
That was brilliant. I never heard that one.
I'm like a hot dog roller, man. Things are rolling all over the place.
That's it.
Well, there's marks all in here. This is all inflamed.
Have you had gua sha or cupping done?
No, nothing.
This is what the Chinese figured out, that you could kind of comb. This combs the tissue to draw out the adhesions, the dead blood that's been trapped in these areas that have been stiff. So the mark isn't normal. It comes out in areas where it directly correlates with your pain. You go, Ed, it's hurting. I turn here. This is almost the exact area you're pointing to. When you turn your neck, you're pulling and moving the tissue that's inflamed. And so it's like having a bruise on your arm and you touch it and it hurts. But it didn't hurt until you touched it. So when you turn your neck, you're mobilizing this tissue and you're feeling it. How about we just get rid of what's in here that's bruised, and then you no longer will hurt to turn your neck. But because it's been so stiff, the circulation is poor. So the circulation, it's not self-resolving. It's not just taking care of itself. These are the roots of your neck. These are the tree roots. And so ultimately, and it felt better for a few days, and then it came back. That's because your head being forward, I told you earlier. We have to get to that problem. That's the orthodontistry part. It takes 6 months, a year. That takes time. It took years to stretch and round your body forward. It's a diminishing returns curve. We get like 50% improvement in 3 months. And then that next 50% takes a year and a half. It's like it's harder to get the, a year and 9 months. It was about 2 years to get everything close to being where it's supposed to be. But you're going to feel better way before that, I'm saying. Right. But it just, when's my ear hole going to get over my shoulders? It takes time to stretch it back.
Yeah, right in there.
Yes, sir. Yes, sir. That's that injury. The side of his atlas right there. Yeah, right there. Yeah. It's like it healed crooked. You had an injury, and then it healed in avoidance, and then now we have compensatory pains because of it healing with the frame bent. And now we have to, in order to really get to the true source, we have to soften the metal, soften the clay, remold the frame back to being straight. Gently turn your head left and right. How's that?
Easier that way, hard.
Yeah.
This way still.
Yeah, restricted on that
Yeah.
side. All right, we're going to face down. We're going to keep working. So the mobility of your chest is what flushes your lymphatics. Your lymphatics are your sewer pipes. The lymphatics don't have a heart like your circulatory system pumps your arteries and veins. Your lymphatics are pumped by mobility. His chest is really stiff. The lymphatics don't drain. So you start developing pockets of crud, dead tissue, waste, and then your body envelops it into a lipoma.
Got it.
You understand? It's not a coincidence that it's actually more on the left side here, because this is the stiffer part of his back here. This is the epicenter right there, and then I got 1, 2, 3.
Oh yeah, I mean it was.
It's not a coincidence. This is directly correlating with right
But now
there.
that I have them, will they go away, or will they all
So-
just be there now?
This is where, again, I'm the only person that really cares to do, there's no research on this. In my opinion is, if we can, depends on how enveloped it is. Like if somebody has a lipoma, the ability to get rid of it depends on how long it's been there, right? Your body will encapsulate and onion it. And if it's been very onioned, it won't be able to rehook up and drain internally. And so you have to, at that point, if you want it gone, get it cut out. Now the difficulty is when you cut it out, they damage the lymphatics just getting in there to take it out. That make sense? Some of the circulation to the area, making it easier for another one to form because of...
Well, I've noticed that when I've gotten them removed, another one pop up.
Another one will pop up again. So,
how many times I say that? Huh?
right. So in my opinion, the only hope is if you do that, you have to have me then afterwards get it moving and stimulate it to reconnect and rehook up the lymphatics that are, it's like a supply and demand. You have to create the demand and your body will fill the supply. You understand? It's like you have to stimulate the area, massage the area, stretch the area, and then the circulatory lymphatic network will then rehook up. It won't do it if we don't ask. So you have to put in the demand, put in the cue, a request, and then see if your body will fill it. And you don't know until you ask. You don't know what the body's how it's gonna respond until you ask for it. There we go. There you go.
But yeah, it's a mess right here. I mean, gee whiz. Right there is underneath it. So
Ew.
this is what's underneath it all that's caused it. Right there. Do you have a foam roller, a 6-inch diameter foam roller by chance at home? No?
We have a foam roller, right, Ralph? The one
Yeah,
used
we
for
just
your-
inherited one from neighbors.
All right, we're gonna, so because of how stiff your middle back is, we're not gonna start with the lumbar dental. So there's a neck dental, which we will start with today, and there's a lumbar dental, which we will probably visit 6 through 8. We'll probably introduce that. We're gonna start with just a foam roller for his back. There's just so much stiffness in here that I want the contact a little bit more broad and him being able to move around a little easier on a roller, and we're gonna practice with that first. And we'll, at the end of our visit today, we'll go over that. But I'm just giving you where we're headed.
Okay.
This is way, relatively even to his neck, this is way stiffer. And I'm not confident that the dental is gonna make the area that I want to move. It's probably gonna make an area that I don't want to move, which means we can't really do it. And this is where typically we wait a couple visits before we bring in the dentals. It's kind of, why did that person get the dental and visit too and I had to wait till visit? Because you weren't ready. We have to first get to a place where you can even stretch
Yeah.
safely, and then we can think about, well, when can I start backing off my visits? Or can you do 20 minutes on a stretch? Well, not yet. Well, until you can do 20 minutes on a stretch that I've shown you, then we talk. But we have to first get to a place where I can even feel confident we can do it without. See, the injured area is going to want to bend the most because it's loose.
Okay.
Again, it's a volunteer system. The stiff part of your back is stiff, and so it doesn't want to bend when you ask it to bend, and it's going to mechanically make the looser part do the bending, whereby you further imbalance your spine, and now you're actually hurting somebody. Now you're actually hurting them. And so we got to be careful. It's like a, daggone Spider-Man, right? With great power comes great responsibility. Thank you, Uncle Ben. With great power comes great responsibility. With great dental power comes great responsibility. Everybody will be like, can I get the dental off of eBay? I'm like, yeah, you can, but you're supposed to be taught how to use it. It's like the first thing my dad taught me when I was like a teenager. He's like, Ed, close your mouth. No breathing out of your mouth. Nobody wants to hear you puffing and puffing on their back.
What is that exactly?
Subscapularis is all the adhesions and glue underneath your scapula here. Just restrictions that have to be compressed so we actually can bring your shoulders back. 26 is when all the growth plates hardened, right? So every year, every decade after 26, it gets harder to change things. Your body gets like set in its
He
ways.
wants to know.
Yeah.
Because he's always researching and trying to learn and figure out what's wrong with it.
What makes it harder? It's why nobody wants to do it. I had a 20-year-old the other day, or 20-year-old. I mean, it's going to be easy. I told him like 5 visits were going to be done. Like,
Yeah.
it's real easy.
Right, so different.
Couple adjustments. I'm going to throw you on dental. I put him on both dentals on the first visit.
Yeah.
I mean, it looked way different than what I'm doing to you guys. I'm going to prep him for a couple more hours before I even throw but you can. He's 19. He's
Yeah.
still soft.
Our son is 20 and he tore his ACL, and how
Right.
he's rebounded.
Mhm.
It's been amazing for us
Right.
to watch. We're just
Right.
like, wow. Like,
Yeah.
Correct. It's
your
just
body at 20 can do amazing things that
right.
Yeah.
ours can't.
Part of this we'll talk about in a minute. There are things called enzymes. There are proteolytic enzymes you can take.
Yeah, I was
Jumped right in.
out at the ball field because Tanner, my oldest,
Mm-hmm.
he plays baseball
Mhm.
up at college and came home for the summer. We're out at the field and
Mm-hmm.
he's like, "Man, you're moving like you're old."
Oh
And I'm
Throws
like,
always been out there throwing and hitting with
yeah,
both of
and
ours.
obviously when he was my daughter's age,
Sure.
I was a lot better, and
Right.
I was showing him,
Sure.
what Dad could do, and now I feel like I'm shortchanging my daughter. But I was out there, I'm like, "Man, you calling me old?"
There. It was all fun and games until he went into my glute. Right.
Right there.
Yes, sir.
Yeah. Huh.
It's very difficult to get a lacrosse ball or anything in here. You just can't get the right angle. It's like laterally. My force is going like that way. It's not posterior pressure. It's this is the angle of the force. You're trying to almost get underneath the sacrum. This joint must be underworking. Has to be, to allow the lower back to be overstressed. Because this is the main engine. So I'm looking at the main engines. You're injuring the backup engines. How did you injure the backup engines if the main engines were running? Well, the main engines aren't running.
So he did something at some point to that.
You're correct. You got it.
Probably through,
Well, this can be more insidious. It can be just sitting in school from 5 to 20.
right.
That'll
We
lock it.
landed
Well,
on
and
his
he
butt
was,
at a
when he
good
was
time.
younger, he was a catcher.
Correct.
He played high school and college sports. I mean,
This is probably just slower. I wouldn't say this is much of a trauma. It can be, but this just happens over 20 years of growing in a
got it.
12, 14 hours a day sitting when you're a kid. There's your problem. Nobody wants to talk about it. What that does to a human body, spine, and
Yeah.
right there. And it's hard. It's right in there. Oh. Okay, feels pretty good. Yeah, real quick, it came out right here. There's a mark right. Come see it?
Yeah.
Come see it, the mark on his
Oh,
tushy.
yeah.
I mean, real quick, it's.
And so that
there's-
just comes
That's what
from,
he's feeling.
that's the area,
It's just
okay.
congestion. The mark comes out almost always where you can feel, go, there's something there.
Got it.
I touch it, doesn't feel right, mark comes out. And then the progression of the care is, and I no longer feel it, no marks come out. They directly correlate. Oh, I got you, come on. There you go, good, oh boy, whoa. Yeah, that has not moved in a while. It was like, the sound probably didn't come up that loud, but I felt it. It was like, joints that were swollen and inflamed at the same time. Come on. It's just easier. Ooh, yes. Okay. All right. That was like right over the. That was like that was the epicenter one right there. All right. Okay.
That's him all the way over you. It'll look interesting online.
And we're not going to talk about that. We're just not going to talk about that. He'll realize that later.
As long as he starts feeling better.
That was very interesting how he had that expression on his face. How did he do that? I don't know. He kind of just levitated above you.
Yeah.
Was he sitting on me? No, I don't think so. He might have been just sitting on you. You want to feel good massage, go ahead. But I'm saying, as long as they're leaving your lower, the only thing I don't want is your lower neck touched and your lower back touched. I want those off limits. Nobody's allowed to rub. Notice I left this alone, right?
Yeah.
You notice I didn't touch your lower back. And I didn't touch your lower neck the entire visit. I worked here, right? I worked up here, I worked the entire chest, and I worked your glutes. But I didn't touch the lower back, and nobody should. You can't help a sprained ankle by further spraining it. You're gonna hurt it.
When I was watching some of your videos, and
Right.
you obviously said that, and I'm like, okay, well, kind of makes sense.
Make sure, but if,
Yeah.
as a patient, sometimes, I don't know, the lady pushed his hand, I don't know where her hand, it's like, well, they need to not do that. You gotta be careful, especially
Okay.
in your 40s, the discs are really swollen. We don't want to be tractioning them too much because so the disc is it's like a balloon or like a piece of tissue, like a skin. If you gape it, you actually can tear the wounds open larger, right? You don't want to be, this is why they do a lot of I don't advise traction at his age, like just hanging upside down inversion. If you're wondering what my opinion on that is, I don't think it's a good idea at this age. If you didn't have care from me until you were like 65, when the discs dry up and they get a little bit more, when they get a little more hard, like bacon, that you're not going to hurt that disc tractioning.
So where am I at on this?
You're here.
Okay.
Right? You're not. I'm guessing. An MRI could. You're maybe somewhere, but I would say more. So there's a nucleus, and it's wrapped in these layers like an onion, and these are torn. That's what allowed the disc to get injured in the first place. There's tears in the annulus. So think of that as like fabric or like your skin. You don't want to sit there and if there's a cut right here, you don't want to be pulling on that.
Right.
Yanking on that, you're going to rip that wound open. But the disc has no feeling, so nobody really gets in trouble for it, right? Felt good, doc, because there's only two things that have feeling, right? The joint, the knuckle where the two bones slide together, that has feeling, and then obviously the wire coming out the side has feeling. So a lot of therapy is designed to take weight off of the joint. Oh, you're a good doctor, thank you, Ed. Right? I'm not actually helping you, right? Pulling your knees to your chest is actually making you worse because it's mashing the disc, right, which is the injury, but it opens up the hole. When I bend forward, you understand? You see how this hole gets bigger? And it takes the weight off the joint. So, thank you. No, you actually hurt me, right? Scary, right? That's therapy in some sense. It's care focused on relief, not correction. I'm actually going to bend you back, right? Ed, I'm feeling, it hurts back here. You're making me confront the things. And so sometimes I can make your posture better and you don't feel better, right? But you're going to last longer and the discs will then they're going to like you. They're going to like not having the weight on them. But you don't.
Eventually feel better. You will
Yeah,
feel
no,
better.
I
understand
it.
I'm not thinking about the next week. I'm not thinking about the next week. I'm thinking about the next 50 years, right? And for you to make it 50 more years, we got to start taking the weight off the disc. But I'm rehabilitating a structure that has no feeling, and that's confusing, right? Your discs are feeling better today. Well, I don't ever feel my discs. You understand? So it's not. I feel the joints. And this hurts here. I feel the muscles. I feel the attachments, and I feel the nerves. Right? Those are. But ultimately, we have to help the nerve. We have to make the disc healthier. You understand? Because as this disc gets thicker, that hole gets bigger. Right? So now it's not hurting at all. And now you can turn your neck without pinching anymore because the disc has been rehydrated. You can only rehydrate the disc by arching back. Because really it's even more complicated. It's actually the front part of the disc that's massively compressed. Right? So the back part, it's like a wedge. You understand?
Right.
The front part is massively compressed, with the back part has been decompressed. You understand? That's why all the nucleus is shifted towards the spinal cord. So we call it extension traction. We bend back, we compress the back part of the disc, and we decompress the front part, right? We're decompressing the part that's always compressed and then compressing the part of this that's never compressed.
I hang from the pull-up bar.
It's not bad.
Right,
We
but-
want to be careful. It does open it up. It's gonna feel good. But we
That's
want to
really
be. It pulls it straight. I'm
Don't
not.
Don't do that then.
Well, briefly for like 5 seconds, 3 to 5 seconds, just to loosen it up. It's fine. But I don't want you to do that for like 5 minutes or 2 minutes.
Right, okay, yeah, I know.
You're gonna start tearing things. But just as a real quick, open it up and then let it
Yeah,
go.
that's what I do, yeah.
Just gently. Opening up the spine is okay, but it's not a stretch. These things I'm going to show you for 20 minutes. We're going to do 20 minutes.
Okay.
Is the goal.
Right.
Not today, but we're going to start. The stuff I'm going to show you, I want you holding it, because it's really the ligaments that have to be stretched. There are rubber bands that these models don't show that wrap this. This whole thing is wrapped in a network of like spider webs called ligaments. And the ligaments on the back, for instance, there's a ligament that goes in between the transverse called intertransverse ligaments, interspinous ligaments. Like there's nuchal ligaments and ligamentum flavum and all these ligaments that wrap this. These have been stretched out. So imagine there's a rubber band between the bottom of that and the top of that, right? When you bend forward, it stretches, right? So these ligaments have been torn up, and they don't have the elasticity to pull you back to curved. And then there's a ligament on the front that's been never stretched, right? And it's real tight, right? So even if I compress in the joint, that tight ligament on the front pulls it right back out of alignment. So this is where it took 102 years for chiropractors to realize adjustments don't change posture. Doing the clicking doesn't change anyone's posture. It doesn't change a single x-ray adjusting people. It's only through stretching the ligaments where you can permanently change, like orthodontistry, moving the teeth. You can't move them by just pushing on the teeth. You have to actually put brackets on, same kind of idea. All right, so there's all this inflammation. It's all the bruising. All that's going to go away a couple days. But my point is we have to get rid of all that. That's causing your pain. There's some on your neck here and shoulders. Tilt right. Okay, it's okay. Tilt right. Okay. Easy. All right. Go ahead and tilt left. A little bit. There you go. Yeah. Go ahead and tilt left. Okay. There you go. And then you just kind of press. Get the idea? It's as close as emulation to my thumbs. And then you put your hand back down and see if your head will stay there. Get the idea?
Yeah.
The first dozen times you do this, it might not be that difficult because your neck isn't really doing it properly. Your neck isn't actually going into the mold. It can become more difficult the second dozen times you do it. And it's getting harder because you're actually doing it properly now. Your neck was so rigid at the beginning, it wasn't actually working over it. So it might feel very easy right now because your neck isn't, if that makes sense, really going into it like it will be in a few visits when I get your neck looser. That's the future. But this is it's simply just going to bed or sleeping for.
Right.
This is about half hour for bed. The idea would be to lay on the yoga mat or lay on the floor, something a little, if it's hard carpet, nothing too, you can do on the bed, but it absorbs it too much. You want to be on something a little more rigid, but that you can do 20 minutes on. You could have the TV to your right, so because there's a bigger bump on the right side of your neck, you can do a little bit of right rotation, which I'll show you. So you could do a little bit of, that makes sense? Mm-hmm. To get a little bit more pressure on that right side. So the TV would be to his right. Do like a 1 month prescription where you have just a little bit of right rotation. It's the ligaments that you haven't been aware of that are tight that are your problem. They're the ones that are holding you in a wrong position, which is then stressing out the discs, the joints, the nerves. If you start feeling stuff down your arm getting worse while you're doing it, get off, come talk to me. If it's just local discomfort in your neck while you're doing it, I'm okay with that. Okay. But, Ed, I was on the dental roll, my hand wasn't numb and it starts going numb when I'm on the dental roll. Stop doing it. Something shouldn't be happening. If it's just local discomfort in your neck, I'm okay with that. Like where it was pressing in, like when I was rubbing your neck, that's areas that are frozen, that need to be moving. They're going to be complaining a little bit, and I'm okay with that. But this is the mold that we got to get your neck used to. The other feature of this pillow is it has the ability to actually let you stretch a little bit. So you open up this flap, looks like a toilet, I know. So it allows your head to sink into the pillow, right? Lay your head for me. Lay your head back. So this is where your neck belongs. Now, when his back and his hips and all that, we have to make his lower back and other parts of his spine not be upset. See, it's hard to lay on your back and bend your knees. It's just, you can't really do it. It's hard to sleep with your knees bent on your back. So we go to our side to bring our knees up. So when we have a lower back problem, like you do, this is not, my lower back feels pressure right now on my back. It's like, well, that's because your back's in trouble.
Is that why he puts a pillow under his knees?
Correct. It's avoidance. It's okay. I expect him to avoid. He's got a lot of stuff to avoid.
Okay.
Right? There's monsters. Okay. Easy. Lay back for me. I got you, bud. I know. Come on. Head back. Come on. Come on, bud. Knees bent. There you go. Breathe. Get the idea?
Yeah.
Mm-hmm. And you would start here in the upper back, the chest, and not the lower back. So you'd push with your feet and roll upwards an inch. You understand?
Yeah.
And you'd stay here. Put the feet together, knees together, and then rotate your knees left. There you go. Stretch. Get the idea? You stretch that, let that right side open up. You're not going to hurt it. Good. And then knees right. About 5-10 seconds each side. And this should be the way, this is the end of the day. Hour, 2 hours for you to bed. Evening time as you're like winding down. Kind of like brushing your teeth. You want to brush teeth and go to bed. You don't want to brush teeth and sit on the couch and watch a movie and then go to bed. You want to let the last thing you see be. So these are to reduce the depth. Remember I showed you earlier I didn't have this behind my back because his back is stiff. So we need to, I don't want you floating.
Right.
and I don't want your lower neck bending too much. What'll happen is if we just bend him back, you're just going to want to bend where you're loose and you end up getting hurt. So this is why I use this to see how his neck isn't bending right now.
Yeah.
That's why I have this here. But if I took this out, his neck would bend too much and it would bend all the bottom.
Want me to do this at home?
Not yet.
No.
I wanted to give you a preview today.
Okay,
Not
but
yet.
just the neck.
Just start with the neck dental
Okay,
today.
so-
Let's just pick one monster at a time.
Okay.
And then I just wanted you to, if you have a roller or get a roller like this, in subsequent visits, I'm going to start. Once your back gets a little softer on the table, I'm going to get more picky and pushy about this.
Okay.
But you're not. Your back was way too stiff on that table. I want to get a couple more adjustments. I finally got a bone to move after an hour of rubbing. I got one bone to move in his middle back. I mean, it was that tight in there. So I want that. That should move on the first adjustment. What'll happen is every visit I'll get more on that first hug. You'll see it happening. You'll go, oh my gosh, I had a lot move there on when it was cold, right?
Okay.
And then I get more confident to put you and the retainers. But well, it moved after an hour of massaging. That's not really moving then. You shouldn't have to sit there and spray WD-40 on the bolt for an hour and heat it up with a blowtorch and then it moved. Like, that's great, but it should move easily. We're trying to get to 20 minutes.
Okay.
They do say starting at 3 minutes. Again, it's up to you, but I want 20 minute
minutes.
stretches
Yeah.
done. If you can't handle it, get off. But
And I should do all 20 minutes to the right. Or should I
well, you
start?
can, yes sir, yeah, you
Okay,
can.
that's best.
If in doubt, keep your head straight, but just a little right rotation to help get that knot on that right side in.
Okay.
And then as you're getting care in here more, you'll start noticing that bone moves easier. It'll level out pretty quickly, and then you can ask me in the future, how's that feeling, Ed? And I might say, yeah, it's just take it now straight in the middle. You don't need
Okay.
to rotate right anymore, but that's the curve. You got to get, the neck goes straight. You got to get that arch back,
Okay.
and that's what's going to long-term help your spine. So, all right, how you feeling? A little loosened up, all beat up?
Good and bad, I guess.
All right, all right.
I'm sore. I mean,
All right.
I feel it.
You got steamrolled by me.
Yeah.
All right.
Thank you.
Appreciate
Thank you very
it.
much.
Yes, sir.
Appreciate
Thank you.
it.
Thank you.